everybody, welcome to my channel, and today we are going to see about cardiac cycle in 10 minutes. What is cardiac cycle? Do you know about this? So the definition can be the cardiac cycle is a sequence of electrical and mechanical events that occur in the heart during one heartbeat from the beginning of one heartbeat to the beginning of the next. So this duration is 0.8 seconds. So what are the phases of cardiac cycle we are going to see in this video? So we have atrial systole, then isovolumetric contraction, ventricular ejection, isovolumetric relaxation, and ventricular filling. So we have atrial systole and diastole, also ventricular systole and diastole. These are the values for atrial events and ventricular events you should know, and this is the time period for particular events which is important to remember. Atrial systole 0.11 second, diastole 0.69 second, and ventricular systole 0.27 and 0.53 for ventricular diastole. This is important and you should remember this for your exams. Then if you see ventricular systole and ventricular diastole time period is important. Systole is 0.27 second and ventricular diastole is 0.53 seconds. So these are the events coming under systole and diastole of ventricle. So let's see this clearly. Let's start with the atrial systole. Atrial systole is nothing but contraction of both atria, which is for 0.1 second. It is the last rapid filling phase. The duration is 0.1 second, and events. The events happening here is it begins after the P wave. The SA node initiates the impulse so that the atria contracts, AV valves open and semilunar valves remain closed so that the blood will goes into the ventricle. 20 to 30% extra blood enters the ventricle, which is known as atrial kick. So this is the atrial systole period. After this, we will be seeing the ventricular systole period. Ventricular systole period is divided into two phases: isovolumetric ventricular phase and the ventricular ejection phase. Isovolumetric contraction is for 0.05 seconds. So the ventricle begin to contract so that AV valves close, producing the first heart sound. So whenever the AV valves close, that is the first heart sound which starts after the QRS complex in ECG waves. So semilunar valves still closed, all valves closed. Okay, so the pressure is rising rapidly, so the ventricular volume will be remaining constant. This is what happens in the isovolumetric contraction. It is also known as isometric contraction. Going into the next phase, ventricular ejection phase, which happens for 0.25 second. It is divided into rapid ejection and reduced ejection. Okay, so the rapid ejection phase, ventricular pressure will be exceeding the aortic and pulmonary artery pressure, so the closed semilunar valves will be opening now. So the blood will be rapidly ejected. Around 70% of stroke volume leaves the ventricle, which is the rapid ejection phase. Next comes the reduced ejection phase, because more of the amount goes to the through the pulmonary artery and aorta. So now reduced ejection phase. In that phase, ventricular contraction decreases, so the blood flow slows. It ends near the T wave in ECG. So the ventricular pressure gradually falls and ventricular repolarization occurs. So this is the reduced ejection phase. Now coming into the ventricular diastole phase, which is for 0.5 second. So if you see in ventricular diastole phase, we have four phases. The four phases are protodiastole, isovolumetric relaxation, rapid ventricular filling, and reduced filling. So the first one is protodiastole. Protodiastole is ventricles begin relaxing so that the blood flow slows. Semilunar valves prepare to close. So the pressure is getting low so that it is the valves are closed. Isovolumetric relaxation, which is for 0.08 second. Semilunar valves completely closed in this. So whenever it closes completely, you will get a sound, that is the second heart sound. All valves are closed, the pressure falls rapidly, volume is unchanged. So these are the things happening in isovolumetric relaxation. This is the important phase where we get the second heart sound. Rapid ventricular filling, and we have reduced the filling. Rapid ventricular filling, when the ventricular pressure becomes lower than the atrial pressure, AV valves get opened so that the blood rushes rapidly into ventricles. About 70% ventricular filling occurs here. Sometimes it produces the third heart sound because there will be rapid rush of blood into ventricle. So that we have three stages: rapid filling, slow filling, which is called as diastasis, and atrial systole completes the ventricular filling. Then the cycle gets repeated. Now going with the relation with ECG. ECG stands for electrocardiogram. Electrocardiogram is a graphic recording of the electrical activity of the heart obtained from electrodes placed on the body surface. So P wave, QRS complex, and we have T wave. P wave represent atrial depolarization, atrial systole. QRS represent the ventricular depolarization. Again, it represents the ventricular systole. T wave represents the ventricular repolarization. So you can see here between P and Q we have PR interval and PR segment, QRS complex, QT interval between Q and T, and ST interval between S and T. ECG is a important topic again. Now coming into the heart sounds. So heart sounds, we have S1 and S2 main heart sound, lub and dub. S1 is lub, which is the closure of mitral and tricuspid valves, beginning of ventricular systole. S2 closure of aortic and pulmonary valve. Do you know what is cardiac output? Cardiac output is nothing but the amount of blood pumped by one ventricle per minute. Cardiac output is equal to the heart rate and the stroke volume. Heart rate is 75 per minute, stroke volume is 70 ml, which is normal, and cardiac output is 5.25 liter per minute, which is the normal value of cardiac output. This is again an important thing you should know when you start studying about cardiac cycle. Here I am providing you with the Viva question for your exams. These are important questions you should know about cardiac cycle and duration of it. Also S1, S2 sound, stroke volume, cardiac output are most important. Thanks for watching and do subscribe for more videos.